In 1996, Laurie Garrett earned the Pulitzer Prize for reporting on the deadly Ebola virus. As a health and science reporter, she has received all of the top 4 awards in American journalism. She is the only writer to earn that distinction. In her new book, Betrayal of Trust, The Collapse of Global Public Health, she argues that large numbers of people around the world are dying not due to a particular disease, but because of failed public health systems. She has been the health and science reporter for Newsday since 1988. I am pleased to have her back at this table. Welcome back.
Thank you.
Boy, this is much tougher than the coming plague to write, because, as we were saying, you travel 5 continents because you're dealing with all kinds of subject matter.
Yeah, it's a much more complicated subject. It requires more of the reader, and it requires more of the writer.
Yeah. Why did you do it?
Because it had to be done. Because it had to be said. It doesn't do any good to get people paralyzed with fear about emerging diseases and things like Ebola without offering some sense of what can be done.
Well, this is mainly an indictment of what is not done and what's wrong with the system.
Yes, but if you can see the problems, you can figure out what needs to be fixed.
What happened in Uganda about the Ebola?
Well, Ebola has broken out again. It is in northern Uganda in a place called Gulu, and it's now become clear that the strain that has emerged there is a kind that's been seen previously in Sudan, in an area called Maridi, Sudan. And what we now understand is going on is that what's between Maridi and this place, Gulu, is this group called the Lord's Resistance Army, which is a very bizarre terrorist group that has been waging battles against northern Uganda for a couple of decades. And most of the people who are coming down with Ebola are refugees fleeing this Lord's Resistance Army. And so now the question is, can the epidemic be contained by just dealing with it in Uganda, or at far greater risk are researchers going to have to try and find their way among the Lord's Resistance Army, which is not a terribly rational group.
They're not going to welcome anybody in.
Probably not. And there are no diplomatic relations between Sudan and Uganda, so that's not a border one can easily cross.
Remind the audience, what does the Ebola virus do to you?
The virus gets into endothelial cells that line capillaries, blood vessels, blood veins, and chews little microscopic holes so that the water and eventually the blood drains right out of your bloodstream, and you begin to hemorrhage massively, internally and externally. Eventually there is virus coming out of your sweat. You are bleeding from your eyes, your nose, your ears, everywhere. People become often quite deranged, go into shock or have heart attacks as a result of this tremendous blood loss. It's a horrible disease.
Wow. And how widespread is it?
We used to think it was extraordinarily rare, but just since the 1995 epidemic, there have been at least 4 outbreaks, and now this new epidemic in Uganda. And I think scientists are coming to the conclusion that the occasional case of Ebola emerges here and there all the time in equatorial Africa as hunters go into the rainforest and come in contact with whatever animal or insect, we still don't know what, carries the virus. The only reason we have epidemics, unfortunately, is that eventually somebody who's sick comes to a healthcare facility. And in much of Africa, these healthcare facilities lack any modicum of public health protection. They have no sterile syringes, no protective gear for the medical staff. And the virus walks inside the body of a person, and bingo, perfect environment for spread, so that really most of the epidemics of Ebola have been hospital epidemics.
When you say the collapse of global public health, what do you mean?
I mean that we are in a situation right now where the most essential components of infrastructure that protects your health and mine and all the people that are watching this are in disarray, and in many places have completely fallen to shreds. The most remarkable example is the former Soviet Union, where the nation fell apart in 1991. Barely had it fallen apart when there was a diphtheria epidemic, about 250,000 cases, and then one epidemic after another. Now life expectancy racing backwards at a pace unprecedented in the history of the Northern Hemisphere, and infant mortality rising, child mortality.
Life expectancy in Russia today?
Today, life expectancy for men is about 58, and it was at a high 65. So it's retreated at a time when most of the world is getting improvements in life expectancy.
How do we stack up?
Well, among the industrialized nations,
We're dead last.
we're at the bottom, and we spend the most of anybody. And not just spend the most. We spend outrageously more on health. The problem is more than 99% of our spending is on medicine. About 1% is on public health. So our focus is always on the individual, you know, my body as a machine that needs repair,
Right.
rather than on the community as a whole, and making sure that this is safe tap water for
Right,
me to drink.
right.
And this is a better bang for the buck. You get a lot more lives saved with this being clean than whatever repair job gets done on the individual. We spend so much on medicine, and by far the bulk of it gets spent towards the end of life. Some estimates say that 20% of all our health spending is on the last 2 weeks of life. And in contrast, little Costa Rica, with 1/10 of the per capita income we have, and spending far less on health than we, has longer life expectancy. It's because they spend on children, they spend on public health, and they basically say that tertiary care, that, you know, third quaternary bypass surgery, you know, you may have to pay for that out of your own pocket. You may need that second liver transplant out of your own pocket.
And explain this to me. Why? It would seem to me this is an obvious positive political policy for a political candidate who's seeking the presidency to advocate, simply because everybody cares about their health. What do you care more about than your health? Yeah, I hear you about individual health, but you can also be vulnerable to things that public health ought to be taken care of, the nature of the water, the nature of other issues. And I would think that people would say, we're not, you know, if you say to millions of Americans, my, you know, previous administration is doing things that damage your health, that ought to be a rallying cry.
You would think so.
But
I researched the entire history of public health in the United States. I went through the original records for New York City going back to colonial period, and looked to see when did the attitudes shift and why, and how did that relate to epidemics and so on. 100 years ago, if you said you were a public health leader, you were a hero. The community, everybody, you know, the only people who were against you were organized medicine, which felt that public health got in the way of their profits by usurping certain things private medicine wanted to do. Today, it's almost precisely the reverse. And the reason is, one, people don't perceive the background of disease as being as great a threat to them individually, so there's a lot of complacency among Americans right now. But I think more importantly, it's that we've become a very anti-government society. We are so anti-governmental, it's remarkable. And public health is by definition a government function. We also no longer really feel a sense of community. As individuals, we kind of float through our cyber community, our office, what have you. But when it comes to the questions such as health, such as
well-being of the community,
the well-being of the community and the sacrifice of the individual on behalf of the community, we've lost that. And so actually 5 times in the 20th century we came very close to voting in on Capitol Hill some form of universal health care, and it was always defeated by the same forces, and it always died for the same reasons. But my feeling was, going through the history, that every single time the debate started from the wrong point, and we're at the wrong point again in the debate between Bush and Gore. We always start from the assumption that what government should do for people is pay for everything. That government, it's either yes or no. Universal health care is supposed to mean every form of surgical intervention, every possible thing you want, government pays for it. Well, there's not a government in the world that can afford to do that. It can't. And especially now with high-tech medicine, and as we head into the human genome era, with what those sorts of medical interventions are going to cost, nobody can afford it. What we should start with is the question, what do we mean when we say health? And what segment of that definition do we think is government responsibility? And I think most American people, in the surveys I have seen, and certainly in the interviews I have done, say for them health means, one, I want my children to live, and I don't want them to have some horrible illness that will stunt their life in some way. I want to live as long as possible and as disease-free as possible, and to somehow just, go to sleep one night when I'm 90 years old and not wake up.
Yeah,
That's everybody's fantasy of perfect health.
Right.
And actually, the things that are the greatest contributors to creating a probability of fulfilling that fantasy are public health, not medicine. Medicine's added less than 4% of all improvement in life expectancy since World War II.
And 96% has come from public health?
Public health and general improvement of our economy, so
Right.
that people are eating better and living in better conditions and so on. Now we have a real threat, because if you look at, as a public health person, at our society today, you would say, wait a minute, now we're all obese. We are consuming the wrong foods. Smoking is making a comeback in a younger generation. We have states that no longer have anybody on the payroll to inspect your drinking water. Nobody. Guaranteeing your drinking water safe. We now globalize our food production so that more and more food is not grown in the United States, and we don't have adequate inspectors to ensure that you won't get cyclospora from those raspberries you're eating that grew in Guatemala. And we can't keep the pace the way we are and not eventually stand back and say, what is health and what is government responsibility? And unfortunately, instead, all that gets argued about in Washington and all that's on the table right now between Gore and Bush is healthcare financing.
Exactly.
How do we continue to pay an impossible bill?
Are any diseases coming back that we thought we'd conquered?
Tuberculosis. Last year, more people died of TB in the world than ever before in human history. The same is true for malaria.
In Africa?
All over the world.
All over
in fact, a #1 spot to statistically acquire tuberculosis today is Siberia. The worst place to be if you're worried about tuberculosis is a jail in Russia.
And what about malaria?
Malaria also hit record levels last year, and it is increasingly drug resistant.
Does it kill more people in Africa than HIV?
No, HIV now outstrips everything.
Does it really?
Yes. And in fact, by 2004, HIV will have outstripped the Black Death of the 14th century and the 1918 influenza pandemic, ranking as the #1 killer in human history as a single epidemic.
Where are we, you think, in finding either some kind of prevention or some kind of cure?
For HIV?
Uh-huh.
It's very grim. I don't think cure is on anybody's radar screen right now. For prevention, we do know some societies have been able to come up with public health policies that slow the rate of HIV spread in their countries, Uganda being a classic.
Right.
But we need a microbicide desperately. We need something women can do to protect themselves. What I've seen on the ground, traveling all over Africa, is that the societies with the highest HIV rates are the ones where the gender power difference is most extreme. And in countries where women really can't say no to sex, and they can't say no not just to their husband, but to any man that approaches them, HIV is
because of cultural factors.
Cultural factors, because they have no power. And they cannot say, you must use a condom. We desperately need an intervention that is under a woman's own control so that she can protect herself. I can't tell you, Charlie, how many women I have interviewed, and it breaks your heart. I fight back tears every time, who have said to me, I knew my husband was HIV positive. I knew that every time we had sex with him, it was like a bullet that could go into my heart. But I could never refuse him, and I could never get him to use a condom. And I just waited and waited until the day came when I knew the bullet had gone in me.
Gee.
Now, as long as that's true, as long as women have no power to say no, you're going to have spread. And there has to be a technology that they can use to protect themselves. The most promising possibility would be some kind of a microbicide foam that would kill the virus, that they could use, that perhaps would be a sort of, as the women say, we need a stealth foam that the men won't realize is there. Otherwise, they won't let them
And
use
there are all
it.
kinds of cultural myths, like if you make love with a virgin, it'll cure you.
Horrible,
All that stuff.
horrible things. I mean, I've been in villages where all the girls say that the men came from the other village and raped them because they thought it would take the virus away.
This book is called Betrayal, The Collapse of Global Public Health. Laurie Garrett, as I mentioned in the introduction, has won about every award you can. She is one of our brilliant reporters on issues of health. Thank you for coming.
Thank you.
We'll be right back.